most people, they think of their fathers as, as being like the Superman and all that, but I was always like, my father really is that. He saves lives for a living.
I first met Dr. Cutrona when I was a medical student. I was at the old Northside Hospital, and he was rounding all over the city, and so I was his medical student. And I remember going on a rotation with him to his office, to the hospital, and every patient was so complicated, and he made it very simple for me to learn.
He's been an awesome mentor, which probably relates back to his educational background as a teacher. He will stop and he will explain things to you. He will explain things to staff. I was kind of amazed when I looked back at some of the stuff he has done in his past. He's been involved in research, he's been involved with publications, he's done a lot of presentations. So he's a perfect mix with his knowledge.
One of the best experiences I had with my father, especially when I was very young, is I knew how important the work was that he did, and I knew that he was very busy and a lot of long hours, but it was great on the weekends getting an opportunity to actually ride with him, and we had the time from the house to the hospital to talk and to chat, but then I actually made rounds with him. So that was some of the best time that I had, was having that opportunity to spend with him, see him live, doing his job, his work, and saving lives. It was an incredible thing to witness. The amount of respect that he had amongst his colleagues, even as a young child, I immediately picked up on that.
To me, he is a maestro in the realm of infectious disease in this area, because he covers so many hospitals, and the infectious disease doctors all look up to him.
I think the teacher/ID doctor is an awesome combination.
He is a natural teacher. He's a natural encourager. And like I said earlier, he's tough, but yet he's tender.
Tough as nails. I mean, he demanded the most out of everybody, the best out of everybody, whether it was for his kids, whether it was for the nurses, the physicians. And I always used to joke when I would see somebody who says, "Oh, I know your father. I think he's the greatest. He's the best." And I'd say it was a nurse. I'd say, "You must have been really good at your job, because if not, you would have gotten the wrath."
Dr. Cutrona's style has evolved over the years too. I'm sure many people will tell you that, as far as how he handled situations early in his career, now later in his career. And I think that's also a testament to him reading the times and knowing that how he has to work to get the job done for his patients. It really is for him, and it's not about Dr. Cutrona himself. It's never been that way. You can just tell that in how he acts. Every time he fights for something, it's to help his patients and to help the hospital. It's rarely, if ever, for himself or his own practice, and that's what kind of separates him as a leader from other people.
He had worked his entire life in the community, providing services to those who needed his special skill set. When the pandemic came, we all needed his special skill set.
Dr. Cutrona, for the leadership that you have shown, for keeping our community safe, for your years of practice, we thank you. Congratulations on receiving the Leadership in Health Award.